Hi, everyone. If you don't know me yet, my name's Mary Ackerley, and I'm an integrative psychiatrist who's been working with mold, Lyme, and chronic fatigue patients for almost 15 years. I'm here today to discuss the current mental health pandemic, the lack of understanding of root causes with overtreatment of the symptoms we call depression and anxiety by mainstream medicine, and how that harms people. In the first section, I discuss how SSRIs are neither as safe nor as effective as advertised and seem to be doing little to staunch the ongoing mental health pandemic. Further videos will discuss root causes, including chronic inflammation from mold, neuroinflammation from infections, and mast cells and trauma diagnosed as psychiatric illness. Including many references, and that will be in the third video of the series. We'll also be discussing treatments, common treatments for depression and anxiety that don't use antidepressants. First, I want to review where we are as a society in treating depression and anxiety. Depression is a really common symptom. About 17% of the population will have at least one episode in their lifetime. WHO has predicted for a very long time that by 2030, interesting date, depression will cause more disability and mortality than any other illness, including cancer, cardiovascular disease, accidents, and war. It has been known for a number of years that antidepressants are no better than placebo or diet and exercise for mild or moderate depression, and only about 10% more effective for the severely depressed. In fact, a good clinical rule of thumb is that SSRIs get about 50% of patients better, about 50% better. In general, for moderate depression, it's very hard for the drug companies to show that their products work better than even placebo, let alone diet, exercise, and fish oil. A very recent study again validated this observation, showing that running twice a week worked as well as SSRIs in resolving depression. Yet, none of these facts discourage clinicians and patients from using antidepressants. 337 million SSRI prescriptions were written in 2021, up from 250 million in 2014. We're going to come back to that number. This is an amazing fact, given there are no generally accepted clinical tests for depression. That's right, one in every 10 US patients are given a prescription for an illness that has no objective lab tests for diagnosis. So, why are we using drugs which barely work, as seen by the ongoing rise in cases, as well as in honest reviews of the literature? Diagnosis is oversimplified. Even the former head of NIMH, Tom Insel, has come right out and stated that functional and structural brain imaging research has not been able to find consistent correlations with classic DSM diagnostic criteria. Oh, and the major risk factor for inappropriate prescribing is female, middle-aged with physical problems, and Caucasian. Sounds a lot like the chronic complex illness population that I see. I think we can all agree there's room for improvement here. So I've been speaking about the problems with SSRIs for many years. You may have noticed my last slide asked, is psychiatry looking in the wrong place by focusing on neurotransmitter manipulation? But in 2022, a critical review of the literature, and there have been many before, finally caught the media's eye and became a common topic of discussion. In a systematic review of studies on serotonin levels in people with depression, it found no evidence that depressed people had lower serotonin levels or abnormal serotonin activity compared to non-depressed people. Now, it's been known since the early 80s, when I was in medical school a long time ago, that the monoamine hypothesis was inadequate to explain the action of antidepressants, which often took 6 weeks to work. But then along came Prozac, the first SSRI, which was wildly successful in part because the low lethality meant it could be prescribed more widely. And drug companies learned that branding depression as a chemical imbalance was a real winner in selling even more product. As the lead author, Joanna Moncrieff, explains, we really don't have any evidence or justification for thinking that these drugs work by targeting an underlying disease or some biological mechanism. They cause changes to the normal brain state that may, in some circumstances, be helpful, but there are other situations when these effects aren't helpful, and there's always a downside to taking drugs. Her statement is a good summary of the current state of the art in SSRI use. Might be helpful, but just as often isn't, and we still really don't know how they work, and there are real side effects. So what happened when drug companies learned to brand the easily understood but wrong message that pills that increase serotonin indicated that the root cause of depression was a chemical imbalance? Sales increased 3,000% over a period of roughly 25 years. And now, SSRIs are the most commonly prescribed medication for 18 to 44-year-olds and are the most commonly prescribed class of drugs in the US. In 2019, we spent $225 billion for mental health issues, up 52% from 2009. And in 2020, the first year of COVID, our spending increased to $280 billion. So why might a reasonable person, such as the psychiatrist Joanna Moncrieff, object to drug companies' misleading advertising? Antidepressants have major side effects of weight gain, anorgasmia, sweating, dry mouth, and vision issues, and people have a very hard time stopping these meds. Withdrawal symptoms are common. Many people, such as this woman quoted in the New York Times, just stay on them for the rest of their life. In marketing, that would be understood as a very successful consumer conversion strategy. Medically, if our goal as physicians is to restore people to health, it doesn't look so successful. Oh, and suicide is the black box warning, huh? The drugs used to lift people out of depression have suicide as a known side effect? And realize suicide rates have doubled in teens from 2008 to 2019 and is now the second leading cause of death in 10 to 14-year-olds. The suicide rate in teens was waning from about 2.3 deaths per 100,000 in 1999 to about 1.5 per 100,000 in 2007. And that was followed by a sudden and unrelenting rise here. Right back to by 2018, we were right back where we were in 1999. In this recently published article by Levine, social media was squarely given the blame. And remember that during this time period, our spending on mental health was up 50%, as was the use of SSRIs. So, the use of antidepressants during pregnancy is generally considered safe, especially when the risk of a mother's depression outweighs any very small side effects. That's what I and every other physician has been taught. However, the results of this recent large cohort study are concerning. They suggest that prenatal SSRI exposure may be associated with altered developmental trajectories of gray matter brain regions involved in emotional regulation in offspring, as well as increases in limbic regions, including the amygdala or fear center. Decreased cortical gray matter inhibition with limbic overactivation is a pattern observed in many psychiatric illnesses such as anxiety, panic, bipolar, and cluster B personalities. Obviously, that is not something any mother would wish for her future child. SSRIs have been available to the public for 35 years. Please remember this small study as I discuss the alarming rise in psychiatric diagnosis and the use of psychotropic medication over the last 35 years. So, with this background of spending on mental health and SSRI usage and side effects, we now encounter COVID. As a society, how well did we handle this viral pandemic? Clearly, mental health suffered, as this poll from 2021 shows that 42% of Americans reported symptoms of depression or anxiety, compared to 11% in years before. I think the 11% is somewhat low, but that is what the CDC tells us. There is nearly half of our country in December 2021 was reporting mental health symptoms. Now, it's not entirely unexpected, since as humans, we tend to favor stability, and change, although helpful for evolution, is usually not enjoyed. This graph shows the increase of deaths due to drugs, alcohol, and suicide, all considered deaths of despair, in 2020. Noticed in particular the very sharp rise in drug overdoses, mostly opioids. Alcohol also rose, while suicide stayed about the same. Total deaths from drug overdoses, alcohol abuse, and suicide were about 187,000. For interest, contrast that to our total deaths from COVID in 2020, which were about 350,000. That means that for every 2 COVID deaths, which most of us were very aware were happening, 1 person was dying for drugs, alcohol, or suicide. I know that close to 100,000 deaths that year were from drug overdoses, mostly opioids, was not something I was aware of. And I think it's fair to state, after looking at these numbers, that the US was experiencing a pandemic of mental health as well as a viral pandemic. In 2020, there was an overall decrease in suicides when you look at all age groups. However, if you look at the marked increase in young males aged 10 to 34, up 13%, and the 10 to 14-year-olds, with smaller increases in females in the same age groups. Again, multiple causes, but in the 10 to 14-year-old group, who would normally be in school with access to resources, including sports and counselors, lockdown needs to be considered. But by 2022, provisional CDC data shows that we were off to the races again. The number of suicide deaths in 2022 is the highest recorded, exceeding the next closest year, 2018, by over 1,000 deaths. Essentially, suicide rates have now increased 50% in the US population, from about 10 per 100,000 in 2000 to 15 per 100,000 in 2022. And these deaths are increasing fastest among people of color, younger people, and those who live in rural areas, with many groups seeing increases of 30% or more from 2011 to 2021. There was a 17% increase in use of stimulants for those who couldn't focus. In 2021, 77 million prescriptions were written for ADHD stimulant medications, nearly 6 million more than in 2020. In the first 2 years of the pandemic, teens' use of anxiety meds doubled from a 9.3% rate of change between 2017 to 2019 to a 17.3% change from 2020 to 21. Remember, most anti-anxiety meds are controlled substances that carry the risk of dependence. Because of the risk of dependence, I would argue that starting a young adult with a lifetime ahead of them on a controlled substance is not a great idea. And during COVID, the use of SSRIs, not surprisingly, continued to increase, especially in women. SSRI usage by women increased to more than 15% prevalence rate by October 2020, compared with about 13% in January 2018. Teenagers, again, not surprisingly, showed the greatest rate of change in SSRI usage, with a 41% increase in usage from 2017 through 2022. 41% is a big increase. And that increase was greatest in females, with 60% of teenage girls in 2021 reporting suicidal feelings. And this is where I wonder, how many of these teens were exposed to SSRIs in utero? In 2021, a total of more than 337 million prescriptions were written for antidepressants in the United States through the course of the year. The US population is about 332 million, and this means that more than one prescription for SSRIs was written for every man, woman, and child in the US. That's really a lot of prescriptions. And this is a key graphic from my talk. Not surprisingly, in light of previous statistics, the use of psych meds increased, but as this graphic shows, they nearly doubled from 15 to 25% of our whole population. So realize now we have nearly half of our population reporting mental health symptoms, and a quarter of them are medicating for their depression, anxiety, and focus issues. Is it reasonable to suggest the US is experiencing a pandemic of mental health, a pandemic that has not ended by any recent statistics I can find? And this is why I feel understanding the controversies around the use of psychotropic medication is so critical. A very large number of people and their unborn children are being prescribed these medications, often for very flimsy indications. Yet, while more of us are medicated than ever, the rates of depression, anxiety, and suicide have surged over the last 20 years. There are only two possibilities, says neuroscientist Thomas Insel, former director of the National Institute for Mental Health. Either the treatments don't work, or what's ever driving these results is getting worse at a much higher rate than the treatments are going up. I think it's a little bit of both. Okay, realize this is the former head of NIMH admitting that antidepressants really don't work that well. This concludes the first part of my three-part series on Brain on Fire, mental health pandemic. The next part will talk about root causes of neuroinflammation, and the third will address common treatments for anxiety and depression, non-pharmaceutical treatments. Thank you for listening.